Good morning, everyone. Good morning, everyone. Myself, Dr. Parvati. My paper is on the topic the association between vitamin D deficiency and diabetic retinopathy in patients with type 2 diabetes mellitus. Diabetes mellitus is a large public health problem which affects more than 415 billion people in the world, and diabetic retinopathy is among the most common diabetic complication. Vitamin D is actually a steroid hormone that is produced in the skin after exposure to sun irradiation. There are a vast array of pleiotropic actions of this vitamin. It has been shown both in vivo and in vitro that vitamin D is essential for the regular insulin release in response to increased blood sugar level and thus glucose tolerance. Vitamin D has an inhibitory effect on the vascular angiogenesis, and vitamin D receptors are ubiquitously expressed in every human tissue including retina. Currently, there is conflicting evidence regarding the association between vitamin D level and diabetic retinopathy. The aim of this study is to determine whether there is an association of vitamin D status and diabetic retinopathy in patients with type 2 DM. Coming to materials and methods, it's a cross-sectional study done among clinically diagnosed diabetes mellitus patients in the age group 40 to 80 years, done at tertiary care hospital in Kerala. Study duration was 3 months and the total sample size is 48 with 24 patients in both of the age groups. Inclusion criteria is patients with type 2 diabetes mellitus in the age group 40 to 80 years. Exclusion criteria includes patients on vitamin D analogs, patients on medications which can alter the vitamin D metabolism, such as rifampicin and phenytoin, subjects with prior diseases that suggested baseline alteration in the vitamin D and calcium metabolism, such as hyper and hypoparathyroidism. Coming to data collection methods, patients' medical history was obtained and was divided into two groups based on their diabetic status and retinopathy findings after dilated fundus examination. The first group consisted of patients with type 2 DM with no evidence of diabetic retinopathy, and the second group consisted of type 2 DM patients with evidence of diabetic retinopathy. And their blood was tested for 25 hydroxy vitamin D levels and FP14 levels. And 25 hydroxy vitamin D levels were interpreted as follows: less than 20 nanogram per ml was taken as deficient, 20 to 29 was taken as insufficient, more than 30 was taken as sufficient, and more than 100 nanogram per ml was taken as potential toxicity. The data was analyzed using ESR software version 1.54. Coming to the results, the mean age is higher in diabetic retinopathy patients, that is a mean age of 66.38 years compared to non-diabetic retinopathy patients with a mean age of 63.29 years. The gender distribution were comparable between the two groups. The vitamin D levels were significantly lower in diabetic retinopathy patients with a mean of 19.83 compared to non-diabetic retinopathy patients with a mean of 25.62. And HbA1c levels were significantly higher in diabetic retinopathy patients with a mean of 8.15 compared to non-diabetic retinopathy patients with a mean of 7.08. The duration of diabetes was significantly higher with diabetic retinopathy patients with a median age of 10 years compared to non-diabetic retinopathy patients with a median age of 5 years. ROC curve analysis was done to calculate the best possible cutoff value of vitamin D level as a significant predictor of diabetic retinopathy, and vitamin D level of 23.505 nanogram per ml was calculated as the most accurate cutoff point below which the patient had a higher risk of diabetic retinopathy. So you can say that 75% of patients with diabetic retinopathy had a vitamin D level which was below the cutoff value, that is less than 23.505 nanogram per ml, whereas only 37.5% of patients without diabetic retinopathy had a vitamin D level which was below the cutoff value. Coming to the discussion, our results indicate a statistically significant difference in the mean age between the two groups, with diabetic retinopathy patients being older. However, the gender distribution was comparable between the two groups. Vitamin D levels were significantly lower in diabetic retinopathy patients compared to those without diabetic retinopathy, and the ROC curve analysis further identified a cutoff value of 23.505 nanogram per ml for vitamin D, below which the patient had a higher risk of diabetic retinopathy. This reinforces a potential role of vitamin D as a predictive marker of diabetic retinopathy and suggests that maintaining adequate vitamin D levels may be important for preventing and managing diabetic retinopathy. The study also found that HbA1c level was significantly higher in diabetic retinopathy patient, and the duration of diabetes was also notably longer in the diabetic retinopathy group. It highlights a critical need for early diagnosis and management of diabetes to mitigate the risk of retinopathy and other complications. These are the studies that agree with the study, whereas studies by Alam et al. And Bonagdan et al. Shows no significant difference in the diabetic retinopathy status between the two groups. Conclusion. This study demonstrates a significant association between the lower vitamin D level and the presence of diabetic retinopathy in type 2 DM patients. Monitoring and managing of diabetic vitamin D levels may be a valuable compound of strategies to prevent or mitigate the progression of DR. And the identified vitamin D cutoff value can be instrumental in clinical settings for early identification of diabetic patients at a higher risk of developing diabetic retinopathy. Future research with our larger cohorts is needed to validate these results. Additionally, RCT is investigating the impact of vitamin D supplementation on diabetic retinopathy progression could offer valuable insights into potential therapeutic strategies. These are my references. Thank you.
Good presentation. How much do you give vitamin D? You say like you have to supplement for all your diabetic patients. So how much you gave?
The standard dose is 50,000 international units given weekly orally for around 2 months if the patient is found to be deficient.
Yeah, it is 60,000. 60,000 international units weekly once for 8 weeks, as you said. Okay, good.
Thank you.
Did you put any slide on the diabetic age? I thought you put the age 60, something like that. Did you have a slide on the duration of diabetes?
Yes, sir. The median age was found to be 10 years in patients having diabetes without retinopathy, and 5 years in patients having diabetes without retinopathy, whereas for patients with diabetic retinopathy, the median age was found to be 10 years of duration of diabetes.
So that is the normal.
Yes.
Compared to vitamin D levels, is there any difference?
No, sir.
That is important, no?
Okay. Thank
You
you.
told when severe deficient patients can be given vitamin D every week. Severely deficient patients. What about the normal patients who need maybe required vitamin D or not daily?
Daily
Diabetic
it is 400 to 600 international units daily dosages.
you are giving to the patients.
No,
Will it
not giving.
then how you are told now you have excluded phenytoin. Exclusion phenytoin, how does it prevents vitamin D absorption? Parvati is deficiency. Phenytoin you told no anti-epileptic drug. You have excluded those drugs who are taking phenytoin and all from the study.
They have said to impair the absorption of vitamin D.
Absorption of vitamin D from where?
Yes, sir.
Which intestines? Which intestine?
Not sure, sir.
No idea. Okay, thank you.